Summer's condition is called Persistent Bacterial Bronchitis, and it's basically a chest condition and an upper airway condition.
Summer needed prolonged periods of time in hospital having intravenous antibiotics, but that treatment is 3 times a day, morning, noon and evening. So in between those times, there wasn't anything actually active going on for Summer. So she actually needed to be at home with her family, doing those normal things. Time in hospital can be very difficult. It can be for the families involved.
We were allowed to bring Summer home, and the IV antibiotics then could be given by the hospital at home team. And then the treatment was exactly the same, but the impact on us as a family, because of the service that was offered, just meant that we could be in a home environment, still spending 2 weeks at home. So Summer couldn't go to nursery, but actually we were back together as a family again. During that year following, I think she'd been on IV antibiotics, a 2-week course, something like between 15 and 20 times, so it was huge. Had we have not had the service that we did, we'd have pretty much spent the year in hospital. Further on down the line, she had a surgical procedure, which is a portacath just fitted in her chest, and an external line could be fitted onto that, which meant that rather than inject into all of the veins directly, we could inject into that line. Hospital at home team came and trained up myself and my wife so that we could inject into that line. The impact now is that what happens when she needs antibiotics is that in the morning and the evening, myself and my wife will give that treatment, and during the day, no matter where Summer is, whether it be at school or if she's at my parents', for instance, they will go out to wherever she is and administer the dose.
As time's gone on, you've been able to see Mum and Dad, we've been able to train them, and you've been able to see them, visibly relax and be able to work together and live together as a family.
Early on in life, every person that she didn't know and that was new to her was inevitably going to stick a needle into her arm or do something like that. And she was afraid, and she wouldn't speak to anyone for years. And actually, as we've got to know the nurses, and they've taken the time, they've been into our home, taken the time to have a look around at Summer's toys and play with her, and actually it's just been completely different. And now one of the favourite things that she likes to do is to play doctors and nurses.
The Children's Palliative Complex Care team became involved. We work in an integrated fashion with hospital at home, and it was recognised that Summer had an increased need for some overnight ventilation. So therefore, hospital at home referred her to ourselves, and then we became involved in terms of supplying the equipment and the consumables for that, so that we can do that proactive caseload management.
I think that the care that's been provided has been absolutely fantastic. It's transformed the way that we have been able to operate as a family unit.
I think the care that's been provided is great.